Chronic obstructive pulmonary disease, also known as COPD, is a group of respiratory conditions that makes breathing difficult for millions of Americans. In the United States alone, COPD was the fourth leading cause of death in 2016 and is currently the sixth as of 2021. Because of this, a Health Resources and Services Demonstration Project was designed to expand access to pulmonary rehabilitation services in critical access hospitals and small rural hospitals that serve communities with high rates of COPD.
COPD is a chronic lung disease. The name says that the main thing about that lung disease is that people have a hard time getting air out. So chronic obstructive pulmonary disease. And there are other chronic lung diseases. For example, where I live in West Virginia, coworkers pneumoconiosis, which the miners call black lung, or obviously asthma. So in many ways, COPD is used as a term for chronic lung diseases in general. And people who have chronic lung disease, and as it gets worse, these symptoms get worse. Shortness of breath, that's all the time, it doesn't go away. Cough, that bothers you all the time. Feeling like you can never get a good breath in. And then often people have more flare-ups of bronchitis, sometimes sending them to the emergency room or the hospital. And in our lifetime, now we see lots and lots of people, even at the grocery store, wearing oxygen. So people become dependent on oxygen. More and more, we're hearing about interstitial lung diseases. And often they all get lumped into COPD.
So when we think about pulmonary disease, immediately some of those things we think about are COPD. And then you can also have congestive heart failure, which also affects your breathing and breathing patterns. The one more prevalent right now that we're really starting to see highlighted is what's now considered long COVID. And the toll it's taking on, not just elderly population, but any population. We have others such as asthma, pulmonary fibrosis, pulmonary hypertension, bronchitis, pneumonia, those as well. But yeah, we're seeing it's your COPDers, your CHFers, and this long COVID are the ones that we're really focusing on.
Cigarette smoking is the most common cause of COPD in the United States. According to the National Survey on Drug Use and Health in 2021, 20.3% of the general U.S. adult population smoke cigarettes. This rate is higher in rural, with nearly 29% of rural adults smoking cigarettes as well. Long-term smoking or exposure to pollutants in the air can also cause damage to the lungs and airways. Pollutants can include chemical fumes, wood smoke, and dust particles, among others. Although COPD is typically associated with smoking or air pollutants, 1 in 4 with COPD never smoked, and the development of COPD may be related to a history of repeated childhood respiratory infections, exposure to secondhand smoke, asthma, or undeveloped lungs.
So smoking is the single most important risk factor. It causes about 70% of the total of COPD, but other causes of COPD include occupational exposures, and we have a special interest in rural America, and many people who are doing farm work have occupational dust exposures.
I think in the rural communities, we have a lot more industry that we're working in with the elements. I do think in the rural areas that, we had a lot of exposure in the coal mines, black lung disease. You didn't see that in the urban communities. You've seen that in those rural communities.
COPD is typically caused by smoking. I guess there's a lot of shame with that when you now have a sickness or an illness that others are going to perceive that, well, you brought this upon yourself. And unfortunately, smoking has a really big impact over time on what it does to your lungs. And so the damage that's done from COPD, it's not reversible. And that's a big deal too. There are a lot of diseases, illnesses that we can cure. This is not one of those diseases. So not only is it a cycle of continuing a behavior potentially that makes it worse, you also have a group of people who are in a rural area and access to care, and really them being able to find out what I can do to make this better is very limited.
Among the best treatments for chronic lung diseases like COPD are pulmonary rehabilitation and care services. These services can enhance lung function, reduce the need for supplemental oxygen, and improve quality of life for those suffering from COPD.
How would I define pulmonary rehabilitation? It's an interesting word because if you talk about rehabilitating something, it's usually bringing it back to its current state. So it's almost not necessarily factual when you call it rehabilitation because you're not able to repair the damage that was done to the lung. I could go up a flight of stairs and not get very winded, but if I've not gone up a flight of stairs in a long, long time and I don't have good muscle strength in my legs, step 1 or 2, I'm going to become winded because I'm placing a demand on my body. My muscles need more oxygen to do this job I'm requesting from it. So my lungs that's the part of me that's going to have to help do the work, my heart and my lungs. Lungs that are healthy can usually compensate that. But lungs that are now damaged, you're asking a lot from those lungs. So if I strengthen your muscles, they are not needing as much help from your lungs. That's really how it works. It's just so we are rehabilitating the muscles, not necessarily the lungs, but we are strengthening the person's, those, especially the largest muscles in your body, your legs, your rear. You need that for everything. Sitting, standing, getting in and out of a car, getting in and out of a shower, a tub. So strengthening those muscles is really the key in the program as far as physical goes. But then there's also a complete mental element to that. You know, the effects of COPD go far beyond a physical condition because the patients are affected emotionally, mentally, psychologically. Because if you think about it, if I have an illness that I know, if I want to go to my, grandson's baseball game, I'm thinking in my mind, am I going to be able to walk from wherever we park our car to the bleachers? Am I going to be able to get there without being so short of breath that everybody's going to be staring at me wondering what's wrong? That's their reality. And then you take someone who, if they are oxygen dependent, if they're at the stage 3, stage 4, now I have the element of, what if there's traffic? What if some other thing happens? And now I don't have enough oxygen to get back home. So the idea is just stay home. So there is such an isolation that occurs with this illness. To me, it is far beyond just the physical. It's so emotional. It takes away someone's independence. And that is what we are trying to really rehabilitate. I want to rehabilitate someone's independence. I want to rehabilitate their belief that I can safely and comfortably go to a ball game, go to a concert, go to a barbecue, participate just in life.
The reason pulmonary rehab is so important and so valuable is that it has been demonstrated in numerous studies to show that people with moderate or severe COPD who go through pulmonary rehab and complete it have less shortness of breath, have greater exercise capacity, have overall better quality of life, have less hospitalizations and emergency room visits. And more, it's starting to show that people with moderate and severe COPD who complete pulmonary rehab actually live longer. So for all of those reasons, pulmonary rehab is really, really important. And what we're doing here is trying to make sure that people in rural areas, remote areas, have something closer to their home.
While pulmonary rehabilitation and care services are a great way of managing diseases like COPD, rural access to care is limited and challenging.
Percent of people who have COPD is almost twice as high in rural areas as it is in urban areas. And yet, that's where pulmonary rehab tends to be the least available because people live a long way from their hospital. They live a long way from the city. And it takes time to do pulmonary rehab.
When I think about the challenges of rural health and getting the care you need, I think of, my uncle. He wouldn't go to a physician. He's like, oh, I'll take care of it myself. Oh, I'll get better myself. I don't need to go. And here he is with COPD and, struggling for air at times. And he's like, nope, I'll work through it. I figured this out. I think they get encumbered in their own world. And then if there is not a specialist or a provider that's readily available to help them, it makes it a challenge.
A lot of people may not even have a vehicle. Well, we don't have bus services. We have a very limited public transportation option. That's something that just started in our area not too long ago, but it's not something that's even a consistent. So you're talking someone would have to really coordinate getting to a doctor and finding out, is this service available for me today? So you have the element of a financial burden. And when you're talking about pulmonary rehab, the expectation is at least 2 days a week for several weeks, up to 12 weeks possibly. So if you looked at someone just having to decide, can I commit to 2 days a week? And right now where we are, the closest pulmonary rehab is 30 minutes from where I'm sitting today. The northern part of our parish is, say, another 10, 15 minutes north. So you're talking 45, 50 minutes for that person. So is that even realistic to think a one-way trip of a half an hour to 45 minutes, doing that, 2 times a week, having fuel? It's a reality. They don't have, the resources to make that happen. So they're just kind of stuck. And so we want to be able to bring the needed services to our community. We want to lessen that burden.
Sparta Community Hospital opened its pulmonary rehabilitation services in February 2023. It started by offering services 2 days a week, but quickly grew to 5 days a week. The growth and success of their program proved the need for pulmonary care options for Sparta and its surrounding community.
I'm Carol Kramer, pulmonary rehab. It's helped me a lot. I was pretty bad when I first came. I had anxiety real bad just from getting in the car, out of the car, into here. Took a lot out of me. And I was pretty weak. I'd lost a lot of muscle mass up here in my upper chest. I hadn't exercised in a long time. I'd get out of the hospital, and by the time I regained my strength to where it was like normal, it really wasn't.
Carol has been amazing. So when she first came in, she was very scared, nervous, anxious. From the start when she was here to where she is now, she's not using a wheelchair. She's using more equipment now. She has actually been on that treadmill 3 times already with me.
I can stay up longer on my feet, unload my groceries out of my car.
She does not give herself enough credit. She has accomplished so much here and has been great inspiration.
I feel safe when I'm here exercising. I know they're monitoring me. They understand how I am. But I have my good days and I have my bad days here. Sometimes I can't finish an exercise. But Danielle, she encourages me to do it. I just keep on going. I want to thank the whole staff. Thank you very much. You've helped me a lot. And you do give me the confidence that I can get better, and I am.
Breathing is easy until it's not. Pulmonary conditions like COPD can negatively impact your life, but pulmonary rehabilitation programs can take you from winded to wonderful. Ask your hospital about local pulmonary care options and learn more about these life-saving services.